My daughter was right. I am limping. And it looks way worse than I thought. I look so uneven. And then she laughed and said, I seriously had no idea. I thought I was walking normally. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. This episode is really near and dear to my heart. If you've been told you'll need physical therapy after your knee replacement, or maybe you've already started, you've probably had both of these thoughts at some point. Is this going to hurt? And is this really worth it? Because on one hand, there's that concern about being pushed too far. And on the other, it can look almost too simple. Some exercises, some walking, a few movements that don't seem like they should make much of a difference. By the end of this episode, you'll understand exactly how physical therapy improves your outcome and why it's one of the key drivers of your success after knee replacement. Physical therapy includes exercises, but it's not just about the exercises themselves. You're rebuilding how your body works, your nervous system, your strength, your movement patterns, your confidence, and your ability to function in your daily life. At first, it can feel like you're just going through the motions, doing the reps, checking the boxes. But over time, if it's done well, something starts to shift. You begin to feel how your body is moving, how muscles are turning on, and how things start to come together again. A lot of people walk into therapy expecting it's going to hurt, that they'll be pushed until something gives, in part because that's how rehab has often been perceived. For a long time, rehab was often associated with being pushed into bending or straightening your knee further than it wanted to go. That expectation is still there for a lot of patients, but it's not true. Appropriate motion is needed. What's gotten more refined over the last 20 years is not the importance of restoring motion, but the way we go about it. One of the most helpful things you can do early on is talk about this directly with your therapist. Ask how motion is typically worked on, what therapy will and won't look like, and how progression is usually approached. When you're on the same page, it takes a lot of the fear out of the process. We still know that motion, especially knee extension, has a major influence on how the knee functions long term. And early after surgery, there's real value in settling the knee, managing pain and swelling, restoring motion, and preventing post-surgical complications. But the newer approach is less about forcing your way through the process and more about understanding what the knee needs at each stage, then matching the treatment to that. So yes, there may be moments that feel uncomfortable, particularly early on when motion is limited and the knee is stiff. But discomfort is not the destination. The aim is to restore what's limited, protect what's healing, and then gradually build strength, movement quality, and capacity as your knee is ready for more. After total knee replacement, your body doesn't just need to heal, it needs to relearn. Your quadriceps muscles, which are essential for walking, standing, and climbing stairs, among other things, are affected in two different ways after surgery. First, they become inhibited. Because of the surgery itself, along with the swelling and pain, your brain has a harder time activating the muscle. In practical terms, the muscle is there, but it's not turning on the way it should. Second, they are weaker. Many people lose strength leading up to surgery because they're not using their leg as much, and after surgery, the muscle can atrophy further. That means it's not able to produce as much force as it did before. So this isn't just one problem, it's two. They layer on top of each other. The muscle isn't activating well, and it also isn't as strong. And both of these have to be addressed for movement to improve. And this is where physical therapy becomes much more than exercise. A skilled physical therapist is not just giving you movements to complete. They're helping your brain reconnect to your muscles, adjusting how much effort you use and guiding you how to move so that the right muscles turn on at the right time. In some cases, that includes tools like neuromuscular electrical stimulation to assist activation when your body is struggling to recruit the muscle on its own. And this is done only when appropriate. So when you're doing something that looks simple, like a quad set or a straight leg raise, What's actually happening is neurological retraining, and that's one part of what physical therapy is doing. Another important part is movement quality. You can regain strength and still move in ways that aren't as efficient or coordinated as they could be, which is one reason physical therapy focuses on how you move, not just how strong you are. Improving how you move, your coordination and control, tends to happen much faster when someone is watching, guiding, and making small adjustments along the way. I remember a patient telling me this in the clinic after her knee replacement. She said her daughter kept telling her she was still limping, and she didn't believe her. Then one day she saw herself on her doorbell camera walking up to the house, and she came back and said, "Michelle, my daughter was right. I am limping. And it looks way worse than I thought. I look so uneven." And then she laughed and said, "I seriously had no idea. I thought I was walking normally." That's the part that's hard to pick up on your own. You can't always see what you're doing, and even if something feels fine, it doesn't always mean you're moving well. And this is where we bring something very specific to the process. We are trained to observe movement in detail, and we do it all day, every day. It becomes something you almost can't turn off. I catch myself watching people walk down the street and thinking about it. Which joint looks stiff? What muscle isn't doing its job? And I'm doing it silently without even realizing it. And that's not just me, that's how physical therapists think. We notice how you shift your weight, how your knee moves when you step, what your hips are doing, how you rise from a chair, even small things that are easy for other people to miss. That trained observation is what allows us to guide you more precisely. We can point out what's happening, help you feel the difference, and make small adjustments. How you shift your weight, how you step, how you sit and stand, so your movement becomes more efficient and more balanced over time. Another key piece is progression, and this is where many people struggle when they try to manage things on their own. After knee replacement, there is a general trajectory, but it's not identical for everyone. Some people move forward steadily, others plateau, and some need adjustments along the way. A physical therapist is constantly deciding what to progress, where to push, and where to hold back, because too little challenge prevents adaptation, while too much can increase pain and swelling. Finding that middle ground, the place where your body adapts without being overwhelmed, is where real change happens. And it can be difficult to consistently find on your own. And built into that progression is safety. It's not just about getting stronger, it's about being able to move safely in your daily life. Getting up from a chair without losing balance, walking without compensating, navigating stairs with control. Those pieces matter because they reduce your risk of falls, protect your joint, and give you confidence to use your knee more fully and more normally in your everyday life. Another important piece is that physical therapy is where your progress is measured in a meaningful way. Clinicians use tools to track how well you're functioning in daily life, not just how your knee looks in the clinic, because your goal isn't simply bending your knee to a number. It's usually walking, getting out of a chair, climbing stairs, and returning to your normal life. Most meaningful improvements in function occur in the first few months after surgery, which makes that window especially important. What you do during that time, your consistency, and the quality of your guidance has a lasting impact. Physical therapy is also about behavior, because even the best program doesn't work if it isn't followed. This process isn't just physical, it's behavioral, and your therapist is there to support consistency, help you stay on track, and navigate challenges as they come up. If you'd like to learn more about consistency, you can go back one episode to episode 61, where I talk about the importance of consistency. If you've ever felt unsure whether you're doing enough or maybe doing too much, that's exactly why I created the Total Knee Success Insider. It's educational content organized around different stages of recovery, so you can better understand what tends to happen as you move through the process. If you want to check it out, there's a link in the show notes. You can sign up there for free. And there's another piece that doesn't always get talked about as much, and that's how you think about your knee. What you believe about your knee directly affects how you move. Modern evidence challenges the idea that appropriate exercise harms the knee joint and instead supports movement as a key part of improvement. But if your understanding doesn't match that, it's very hard to act on it. And that's part of what physical therapy helps you recalibrate. There's a quote often attributed to Henry Ford, and I think it fits here. Whether you think you can or you think you can't, you're right. It's not meant to be taken literally in every situation, but it captures something important here. If you believe movement will damage your knee, you tend to move less. If you believe pain means harm, you hesitate. If you believe your knee is fragile, you protect it in ways that can actually slow your progress. On the other hand, when you start to understand what's actually happening and what your knee can safely handle, you move differently. You're more willing to load it, to practice, and to build back capacity over time. This is where all of this starts to show up in your actual results. Physical therapy is one of the key factors that helps maximize the benefits of your surgery, and structured, guided rehabilitation improves the likelihood that patients achieve meaningful functional improvement after knee replacement. That difference is real. It can be the difference between feeling like your surgery worked and feeling like you truly got the success you were hoping for, or feeling like something is still missing. Everyone's experience and what success looks like can vary from person to person. Different people have different goals, needs, and starting points, and some people benefit from more frequent visits while others do well with a more independent approach. The key is not the number of exercises or visits, but whether the plan fits your situation and supports the kind of outcome you're working toward. And when you look at what actually drives your outcome, it really comes back to this: strength, movement, coordination, progression, and consistency all working together. And if you're getting ready for surgery, or if you're already in this process, this is really an invitation to lean into it. Physical therapy is your opportunity to work with someone who can help you move forward with purpose, adjust along the way, and stay on track toward the kind of result you're hoping for. And we're here for that. We pay attention to the details, we make adjustments as you go, and we want to partner with you in this process, working alongside you so you can build strength, move better, and get back to your life with confidence. In the next episode, we're starting a 4-part series on pain, beginning with episode 63, What Pain Really Is and Why You Feel It. It's the foundation for everything that follows, and it will give you an updated framework to make sense of pain as you go through this process. So remember, this is what physical therapy is really about. It's not just the exercises. It's the details, the adjustments, the things you might not even notice. Like that patient who didn't realize she was still limping until she saw herself on her doorbell camera. This is your opportunity to work on those things in a way that's intentional, guided, and consistent. So you're not going through the motions, but actually improving how you move, how you feel, and how you function day to day. Thanks for joining me today. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.